School districts across the area are releasing their back-to-school safety plans, and the statewide school agency hopes all of them follow certain guidelines.
Our Christina Laurie explains what these look like and how they're designed to keep your family safe.
Many of these latest recommendations seem like common sense. Keep your kids home when they're sick, encourage them to wash their hands, cover their coughs. But there are several small changes, too, that doctors say when implemented together will add up to a big difference.
The CDC recently added a recommendation that fully vaccinated people who've been exposed to someone with COVID should get tested 3 to 5 days afterwards and wear a mask in public indoor settings for 14 days or until they receive a negative test result. The latest guidelines from Wisconsin's Department of Public Instruction recommend schools follow that, meaning a fully vaccinated student who's been exposed to COVID can still come to school while waiting for their test results, but must wear a mask. If their test ends up positive, then that student would need to isolate. The updated recommendations also double down on masks, saying all students and staff should wear them, vaccinated or not.
1, we know they're safe. 2, we know they're extremely effective. Researchers across the country studied all kinds of schools, and they looked at kids in schools who were wearing masks really the correct way and much of the time, and found that that was so protective that those kids who had been quarantined when they were exposed to someone else who was masked, very few of them went on to develop COVID.
Every major medical association from the CDC on down recommends masks, and they've been consistent on that throughout the pandemic. But the 6-foot social distancing recommendation is changing. We'll talk about that ahead at 6. Reporting in Madison, 4 News 3 Now, I'm Christina Laurie.